It's a new era of access to health care for Mecklenburg County. The health department's mission is to promote and protect the public's health, and that work is now mobile. Mobile means access on a whole new level. Mecklenburg County Public Health can now hit the road and be at any and every corner of the county. The outcomes can be transformational, says Health Director Dr. Raynard Washington.
I'm extremely proud. I think it gives us an opportunity to really expand our reach as a department, as a county, as a community, to make sure that we are bringing health to our community and that everybody here has an opportunity to be healthy. And that really is our ultimate goal.
On this day, this mobile unit was deployed to a county recreational center for COVID and flu shots for seniors.
You have to protect your health. It's the greatest asset you have is your health. If the county can come to you, that's beautiful. It all works out.
But the mobile unit has also been deployed for public health threats.
Beyond bringing our preventive health care services to folks in the community, these mobile units also give us an opportunity to mobilize very quickly when we have to respond to infectious disease threats in the community. We've had several examples of this, mpox as well as tuberculosis, as well as pertussis that occur in non-healthcare settings like educational settings or at houses of worship.
Assistant Health Director of Clinical Services Glenda Dancy, a 20-year nurse herself, led her team on the first such mission with very little notice.
We were really excited that we were able to deploy in less than 24 hours and be available to promote immunizations and prevent the spread of disease in such a fast turnaround time. We arrived around 6 o'clock in the morning. We wanted to make sure that we were able to be there when the first parents and children arrived to provide education and also immunization support if that's what they needed.
Dancy and her team also understand it's not just about the service, it's the human connection that's needed in such a moment.
We had one mom who was just in tears. I mean, she was just a little anxious, not quite sure what was going on, not even aware that we would be there, but to be able to bring her inside the mobile unit, close the door, calm her, provide her with the education, and ultimately she vaccinated her child.
Public Health now has a second mobile unit. It was deployed for Charlotte Pride in August. Is all this worth it? You bet, says Dr. Washington.
This allows us to bring the health department on wheels to those facilities to do testing, to administer vaccines, to do screenings in a safe, HIPAA-compliant, medically appropriate space that doesn't exist in those facilities. And we don't have to ask people to come to our buildings. We don't lose people to follow up because we can bring the health department right there on site in these mobile units.
Some of this work the general public may not see, such as a pilot program to vaccinate students at school. Not a mass vaccination event, but a strategic initiative which vaccinated almost 200 Charlotte-Mecklenburg students. Michael Eby leads the mobile units.
All of that work that's going on behind the scenes that people don't really realize, and when you add it up over time throughout the school year, you can have a really tremendous impact. So for us, you multiply that over the months of the school year, and especially if you work in partnership with the school system, with our school health nurses, you identify students that are coming due or are due for their vaccinations, we can work more proactively than reactively.
For public health leaders, this has been worth the wait.
It took about 2 years for the mobile units to get here, and in the meantime, we've been planning to effectively deploy the units, and so to actually see them in action, we were very proud.
The next generation of public health going mobile, the pediatric dental unit.
All right, come on, guys. Good job.
In our region, more than 1 in 10 kindergartners have dental issues. 1 in 4 children have untreated cavities in their permanent teeth. That interrupts learning and so much more.
What happens if they don't get that care? It just gets worse. And so oftentimes we have kids who end up even in the emergency department because they have cavities that have gotten infected or abscesses in their mouth, and the cost of those visits to not just the family in terms of the impact on the child and them missing school are so great, but also the cost on the system is great. Though any one of those visits can cost thousands of dollars that we could have avoided if we simply had an opportunity to take care of that child before the situation got any worse.
A new era for Mecklenburg County Public Health is underway, one where the county meets its residents where they are.